If you want to understand swallowing, just break it down into these 4 simple stages. Stage 1, we call it the oral prep stage, and this is just your mouth preparing to swallow. So we got your jaw, we got your teeth, and we got your tongue. All 3 of these structures are working together when you take your bite of food. They're chewing the food, and they're mixing all of those little crumbs with saliva to turn them into one cohesive ball of food. They're shaping it into the ball, and they're making it more manageable for the next stage. And the next stage is called the oral stage. And this is just focused on movement around the mouth. So your tongue is going to take the ball and send it to the back of your mouth. And towards the back of your mouth, there's a little soft spot right back here. And that soft spot at the roof of your mouth is going to move, and it's going to close the opening to your nose. And this is going to keep the food from moving up into your nose. And then we're going to go to stage 3, and that's going to be at the top of your throat. And the food's going to enter your throat, and then all the muscles in your neck and in your throat are going to squeeze. And this is going to cause the food to go down. There's a little tissue flap that'll close off your airway, making sure that the food doesn't enter your lungs. And then as it gets further down, towards the bottom of the throat, it's going to get close to this tube. So there's the bottom of your throat. It'll then enter this tube, and that's stage 4. And then this tube connects your throat to your stomach. And all these muscles are going to keep squeezing, continuing to move the food down. And then once it reaches your stomach, swallowing's over, and then digestion begins. As a medical professional, it is very important that you understand each stage of the swallowing process, including all of the muscles, all of the nerves, and all of the biomechanics. Beginning with the oral preparatory stage, first the individual has to have bolus acceptance. So an individual first has to accept the bolus, meaning there will be a sensory recognition. They will have some sort of salivation indicating that they are ready to begin. Once there is this indication, the lateral pterygoid and the suprahyoid muscle will help with jaw stabilization. And then once the food is in the mouth and the bolus is placed, the muscles innervated by the facial nerve is going to help with lip closure. Once everything is in the mouth, we are going to have the food contained within the oral cavity through buccal tension. Buccal tension is achieved using buccinator muscles and risorius muscles, and this prevents food particles from falling into all of the lateral sulci. Once it's there, the food mastication then can begin. So the movement will be achieved through medial pterygoids, the masseters, and the temporalis muscles, which all are innervated by the trigeminal nerve. And as this is happening, the bolus will continue to get mixed with saliva produced from the salivatory glands. I have a picture of those. So that includes the submandibular, sublingual, and the parotid salivatory glands, and all of these produce special enzymes to help break down and lubricate the bolus. And then lastly, in the oral preparatory stage, the bolus continues to get formed into this small softball through the intrinsic and the extrinsic muscles of the tongue, with some help with cranial nerve innervation by the hypoglossal, the glossopharyngeal, and some vagus nerve. The oral transport stage focuses on the movement of the bolus posteriorly. The tongue tip will elevate and the tongue blade will move upwards towards the hard palate. The tongue movement is achieved through the intrinsic muscles as well as the genioglossus, the styloglossus, and the hyoglossus muscles. As for the mylohyoid, it will continue to support the tongue as the mandible elevates, assisting the suprahyoid muscles to raise the hyoid bone. The tongue will be squeezing the bolus as it's propelling it towards the fascial pillars into the oropharynx. Once it's reaching this position, it's going to create a positive pressure, and as the head of the bolus reaches the back of the tongue, it is going to intersect with the mandible. Once it intersects, a swallow response will be triggered, and the hyoid bone will begin a movement. Once the movement is triggered, it's going to initiate the pharyngeal swallowing response. Once this response is triggered, then the third stage is activated. Once the pharyngeal conversion stage begins, the very first step to take place is the soft palate elevating and merging with the pharyngeal wall, closing off the velopharyngeal port to keep food from being regurgitated through the nose. This happens through the primary action of the levator veli palatini, and it's innervated by the vagus nerve. As for the tongue, it's pushing the bolus into the pharyngeal walls, and the epiglottis inverts to protect the airway. The pharyngeal constrictor muscles, innervated by the glossopharyngeal, vagus, and accessory nerves, contract from top to bottom while pushing the bolus downwards. The long pharyngeal muscles contract at the same time to put pressure on the bolus until it's reached the cricopharyngeus muscle. The hylolaryngeal elevation and anterior excursion is achieved by the suprahyoid muscles elevating the larynx and the hyoid pulling it anteriorly. The bolus passes over the epiglottis to the upper esophageal sphincter, and it opens as the larynx is elevated through the cricopharyngeus muscle relaxing. After this, you get to the final stage, the esophageal phase, and it takes over as the bolus passes through the relaxed cricopharyngeus. The esophageal peristyalius moves the bolus as it continues to pass through the lower esophageal sphincter into the stomach, and as the airway opens, the levator and the tensor veli palatini relax to lower the velum. As the laryngeal vestibule opens, the hyoid drops, and the VF opens. The larynx and the pharynx return to the resting position, and respiration begins again.